Blocked arteries develop when fatty deposits, known as plaque, build up along the inner walls of the arteries, restricting the flow of oxygen-rich blood to vital organs and tissues. While arterial blockages are most commonly linked to heart disease, they can also impact the blood vessels in the legs and feet, leading to a condition known as peripheral artery disease, PAD. The arteries in the lower extremities are responsible for delivering oxygen and nutrients to muscles, nerves, and skin. When these arteries become narrowed or completely blocked, circulation is significantly reduced, resulting in discomfort, impaired mobility, and a higher risk of severe complications. Welcome to Healthy Life Channel, where we explore vital topics to keep you well-informed and prioritize your well-being. Like this video if you're intrigued by natural health solutions. If you're new here, hit subscribe and enable notifications for our latest updates. Also, drop a comment below and let us know where you're watching from. We love connecting with our community. Blocked arteries in the legs and feet tend to be more prevalent in individuals over the age of 50, particularly those with underlying conditions such as diabetes, high cholesterol, and hypertension. Additionally, lifestyle factors such as smoking, obesity, and a lack of physical activity increase the likelihood of developing PAD. Despite affecting millions of people worldwide, PAD often goes undiagnosed until symptoms become severe. Many individuals dismiss early warning signs as normal aging, allowing the disease to progress unnoticed. If left untreated, PAD can lead to chronic pain, non-healing wounds, infections, and in extreme cases, tissue death, which may necessitate amputation. Furthermore, poor circulation in the legs and feet is often a sign of more widespread arterial disease. Individuals with PAD have a significantly higher risk of heart attacks and strokes due to systemic vascular damage. Identifying symptoms early and making lifestyle modifications, such as engaging in regular physical activity, following a heart-healthy diet, and quitting smoking, can help slow the progression of the disease and improve circulation. But before we dive deeper, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. Stay tuned till the end, as number 1 is a sign that 90% of people often overlook. 10 warning signs of blocked arteries in the legs and feet. 10. Erectile dysfunction in men. Reduced blood circulation due to narrowed or blocked arteries can affect more than just the legs. It can also impact a man's ability to achieve and maintain an erection. Proper blood flow is essential for healthy sexual function, as an erection depends on the efficient delivery of oxygen-rich blood to the penile tissues. When circulation is compromised, the arteries supplying the pelvic region may not receive enough blood, leading to difficulties with sexual performance. Many men overlook erectile dysfunction, ED, or assume it is caused by stress, aging, or hormonal changes. However, in some cases, ED can be an early warning sign of vascular disease. Since the arteries in the genital area are smaller and more sensitive to blockages than those in the legs, ED may appear before other noticeable symptoms of poor circulation, such as leg pain, numbness, or cold feet. The same buildup of plaque that restricts blood flow in the legs, causing conditions like peripheral artery disease, PAD, can also affect the arteries supplying the reproductive organs. Over time, this can result in chronic erectile dysfunction, indicating a more widespread problem with cardiovascular health. Ignoring this warning sign could allow vascular disease to progress, potentially leading to more serious complications such as heart attacks or strokes. Addressing circulation issues early can improve both vascular and sexual health. By making lifestyle changes such as increasing physical activity, maintaining a heart-healthy diet, quitting smoking, and managing conditions like high blood pressure and diabetes, men can enhance blood flow and reduce the risk of further complications. Seeking medical advice at the first signs of ED, especially when combined with other circulation-related symptoms, can help detect and treat underlying vascular problems before they become severe. 9. Muscle atrophy. Muscle atrophy, or the gradual loss of muscle mass and strength, occurs when tissues do not receive an adequate supply of oxygen and essential nutrients due to restricted blood flow. When circulation is impaired, the body struggles to sustain and repair muscle fibers, leading to noticeable thinning or weakening of the legs over time. If you observe that your legs appear smaller, feel softer, or lack their previous firmness, it could indicate a serious reduction in blood circulation. As the muscles deteriorate, everyday movements, such as walking, climbing stairs, or standing for extended periods, can become increasingly difficult. In more advanced cases, a lack of oxygen and nutrients can also affect coordination and balance, increasing the risk of falls and injuries. Persistent muscle weakness is a sign that the arteries supplying blood to the legs and feet may be significantly narrowed or blocked. This can lead to further complications, including chronic fatigue and discomfort that worsens with activity. If left untreated, severe cases of muscle atrophy may contribute to long-term mobility issues. Preventing muscle atrophy and improving circulation requires a combination of lifestyle changes and medical intervention. Engaging in low-impact exercises such as walking, swimming, or leg-strengthening activities can help maintain muscle mass and encourage better blood flow. Additionally, addressing underlying circulation issues through proper medical care can prevent further muscle deterioration and enhance overall vascular health. 8. Leg fatigue or heaviness. Experiencing persistent fatigue or a sensation of heaviness in your legs, even after minimal activity, can be a sign of peripheral artery disease, PAD. Unlike typical muscle fatigue from exercise, this type of exhaustion occurs due to inadequate oxygen supply to the muscles. When arteries become narrowed or blocked, the muscles in the legs receive less oxygen-rich blood, making movement more difficult and causing tightness, cramping, and a feeling of heaviness. Many individuals mistakenly attribute this discomfort to aging or a lack of physical fitness, but it is often an early warning sign of circulation problems. As the condition progresses, leg fatigue may become more pronounced, making everyday tasks, such as walking for extended periods, climbing stairs, or standing for long stretches, more challenging. In advanced cases, discomfort and fatigue may persist even while at rest, indicating severe arterial blockages that require immediate medical attention. To improve circulation and reduce these symptoms, lifestyle adjustments such as engaging in regular low-impact exercise, like walking or swimming, maintaining a balanced diet, and avoiding smoking can help. These measures can enhance blood flow, strengthen muscles, and slow the progression of vascular disease. However, if leg fatigue continues to worsen, a medical evaluation is necessary to determine the severity of the condition and explore potential treatment options. 7. Weak pulse in feet. A diminished or absent pulse in the feet can indicate a significant reduction in blood flow due to arterial blockages. Normally, arteries deliver a strong, rhythmic pulse as blood circulates to the lower limbs. However, if you struggle to detect a pulse on the top of your foot or behind your ankle, or if one foot has a significantly weaker pulse than the other, it could be a sign of restricted circulation. This impaired blood flow can lead to a variety of symptoms, including persistent discomfort, tingling, numbness, and, in severe cases, tissue damage. Over time, reduced circulation can weaken the muscles and skin of the legs and feet, increasing the risk of wounds that take longer to heal or fail to heal at all. You can check your pulse at home by placing your fingers lightly on the top of your foot near the base of your big toe, or just behind the ankle bone. If you have trouble locating a pulse, try adjusting your fingers slightly or applying gentle pressure. If your pulse remains weak or difficult to detect, especially when accompanied by symptoms like leg pain, discoloration, or cold feet, it is crucial to seek medical attention. A healthcare provider can perform additional tests, such as the ankle brachial index, ABI test, which compares the blood pressure in your arms and legs to assess circulation efficiency. If poor circulation is confirmed, treatment options such as regular exercise, dietary changes, or medical interventions may be recommended to improve blood flow and prevent further complications. 6. Hair loss on legs and feet. Hair growth is directly linked to the circulation of oxygen and essential nutrients, both of which are transported by the bloodstream to nourish the hair follicles. When blood flow becomes restricted due to arterial blockages, these follicles receive insufficient nourishment, causing hair to grow more slowly, become thinner, or stop growing altogether. This effect is particularly noticeable on the lower legs, ankles, and toes, areas farthest from the heart, where blood circulation is already more challenging. If you observe sudden hair loss or smooth, bald patches on your legs, it may indicate an underlying vascular issue rather than just a natural consequence of aging. Many people dismiss the loss of leg hair as an age-related change, but when it occurs alongside other symptoms such as cold feet, numbness, or changes in skin color, it can be an early warning sign of poor circulation. Insufficient blood flow not only affects hair growth but also weakens the skin, making it more prone to dryness, flaking, and irritation. Over time, compromised circulation can slow wound healing, increase sensitivity to temperature changes, and contribute to additional complications such as skin infections or ulcers. Recognizing these changes early and addressing circulation problems through lifestyle modifications or medical intervention can help prevent further deterioration of vascular health. 5. Shiny, thin, or discolored skin. Changes in the texture and color of the skin on your legs and feet can be early indicators of poor circulation and arterial blockages. When blood flow is significantly reduced, the skin may appear unnaturally smooth, thin, or shiny. The affected area might feel more fragile than usual, making it prone to injuries, cuts, and bruises that heal slowly. In addition to changes in texture, restricted blood supply can alter the skin's color. Some people may notice that their legs appear unusually pale due to reduced oxygen delivery. Others may develop a bluish tint, which suggests that oxygen-depleted blood is struggling to return to the heart. When the legs are in a lowered position, such as when sitting or standing for long periods, the skin may take on a reddish or purplish hue as stagnant blood pools in the lower extremities. Poor circulation also affects the skin's ability to regulate temperature. Some individuals may experience persistent coldness in their legs and feet, while others may feel an unexplained warmth due to underlying inflammation. These symptoms can make the skin more vulnerable to dryness, cracking, and ulcer formation, further increasing the risk of infection. Taking proactive steps such as keeping the skin moisturized, avoiding excessive pressure on the legs, and wearing well-fitting shoes can help maintain skin health. However, these external measures do not address the underlying issue of blocked arteries. If you notice persistent skin changes, especially in combination with other symptoms such as pain, swelling, or slow-healing wounds, it is essential to seek medical evaluation. Early detection and treatment can help restore circulation, prevent further complications, and improve overall vascular health. 4. Sores or wounds that won't heal. One of the most alarming signs of poor circulation due to blocked arteries is the presence of wounds, blisters, or sores on the feet and legs that take an unusually long time to heal, or do not heal at all. The body relies on a steady supply of oxygen and nutrient-rich blood to repair damaged tissue. However, when circulation is restricted, even minor injuries struggle to heal properly, increasing the risk of infections. Without sufficient blood flow, the immune system becomes less effective in fighting off bacteria, making wounds more susceptible to infections that can spread rapidly. In advanced cases, untreated sores may develop into deep ulcers, which are extremely painful and difficult to manage. If the blood supply to the affected area remains severely compromised, tissue death, gangrene, may occur, potentially leading to amputation if medical intervention is not sought in time. If you notice that a wound on your foot or leg remains open, red, swollen, or slow to heal, do not ignore it. Keeping the affected area clean, wearing comfortable and protective footwear, and avoiding injuries can help prevent complications. However, these measures alone are not enough if the root cause is poor circulation. Seeking medical attention for persistent non-healing wounds can help identify the extent of arterial blockages and allow for appropriate treatment to restore blood flow and promote healing. 3. Cold feet or legs. When circulation is compromised due to blocked arteries, one leg or foot may consistently feel colder than the other, even when exposed to the same temperature conditions. This occurs because narrowed or obstructed arteries are unable to deliver an adequate supply of warm, oxygen-rich blood to the affected limb. The difference in temperature may be subtle at first, but if one foot or leg remains persistently colder than the other, it could be an early warning sign of peripheral artery disease, PAD. Over time, poor circulation may not only cause discomfort but also increase the risk of numbness, tingling, or tissue damage as the cells in the affected area struggle to receive essential nutrients. To check for this symptom, compare the temperature of both legs by touching them with your hands, particularly along the toes and feet. If you notice a consistent and noticeable difference, especially when accompanied by symptoms like pain, discoloration, or delayed wound healing, it is crucial to seek medical evaluation. Temporary measures such as wearing warm socks or using heating pads may provide short-term relief, but they do not resolve the underlying issue of restricted blood flow. If left untreated, poor circulation can lead to severe complications, including ulcers, infections, or, in extreme cases, gangrene, which may require surgical intervention. Seeking early medical attention can help identify the cause and prevent further damage to the blood vessels and surrounding tissues. 2. Numbness or weakness in the legs. When arteries become blocked, the nerves and muscles in the legs receive insufficient blood flow, leading to sensations of numbness, tingling, or persistent weakness. Some individuals describe the feeling as pins and needles, while others experience heaviness or difficulty moving their legs. Even short walks may become exhausting, and climbing stairs or maintaining an active lifestyle can become increasingly challenging. Poor circulation can also affect nerve function, making it harder for the legs to transmit and receive sensory signals. This may result in reduced coordination and balance, increasing the risk of tripping or falling. As PAD progresses, standing for prolonged periods may become uncomfortable, and pain may persist even during rest. In severe cases, prolonged oxygen deprivation can cause permanent nerve damage, reducing sensation in the legs and feet. This can be particularly dangerous, as individuals may not notice cuts, bruises, or infections, leading to complications such as ulcers or slow-healing wounds. A medical evaluation can help assess circulation through pulse checks, blood pressure measurements, or imaging tests that examine blood flow in the legs. Incorporating regular exercise, adopting a heart-friendly diet, and avoiding smoking can help improve circulation and slow the advancement of arterial disease. By recognizing these early warning signs and making proactive lifestyle changes, individuals can reduce the risks associated with blocked arteries and improve their overall vascular health. 1. Leg pain while walking. Claudication. One of the earliest and most common signs of PAD is leg pain, cramping, or burning sensations during physical activity, such as walking or climbing stairs. This pain, known as claudication, typically begins in the calf muscles, but can also affect the thighs, hips, or buttocks. It occurs because the muscles require more oxygen during movement, but narrowed arteries fail to supply an adequate amount of blood. At first, the pain subsides with rest as oxygen demand decreases, but as the condition worsens, discomfort may persist even when the individual is inactive. Many people mistake this pain for normal aging or muscle fatigue, but it serves as an early warning sign of restricted blood flow. Ignoring it can lead to worsening symptoms, making even short walks or prolonged standing difficult. Over time, reduced circulation can cause tissue damage, slow wound healing, and increase the risk of infections or, in severe cases, gangrene. Lifestyle adjustments such as engaging in moderate physical activity, maintaining a balanced diet, and avoiding smoking can enhance circulation and slow disease progression. If leg pain occurs frequently with movement, seeking medical evaluation is essential. Maintaining strong circulation is key to preventing serious vascular complications. Here are some effective ways to support better blood flow and overall heart health. 1. Quit smoking. Tobacco use damages blood vessels and accelerates plaque buildup, significantly increasing the risk of circulation issues. Quitting smoking is one of the most effective steps to improve vascular health. 2. Stay physically active. Regular movement, even gentle activities like walking, keeps arteries flexible, improves circulation, and strengthens the heart. Exercise also helps prevent conditions such as high blood pressure and diabetes, which can contribute to arterial damage. 3. Manage underlying health conditions. Keeping blood sugar, blood pressure, and cholesterol levels in check is essential for preventing damage to blood vessels. Conditions like diabetes and hypertension weaken arteries over time, making circulation problems more severe. 4. Eat a heart-healthy diet. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports cardiovascular health. Reducing saturated fats, refined sugars, and processed foods can help prevent arterial blockages. 5. Monitor symptoms and seek medical advice. Persistent leg pain, numbness, cold feet, slow-healing wounds, or erectile dysfunction should not be ignored. Seeking medical attention early can help diagnose and manage circulation issues before they worsen. Your legs can provide crucial clues about your overall cardiovascular health. Pain, numbness, hair loss, skin discoloration, or changes in toenail growth can all indicate circulation problems that may affect more than just your limbs. Recognizing these early warning signs and taking proactive steps to improve circulation can help prevent serious complications like heart disease, strokes, or chronic vascular conditions. Your health is in your hands. Stay informed, listen to your body, and seek medical advice when needed. If you found this information helpful, don't forget to like, share, and subscribe to our YouTube channel for more valuable health insights. Turn on notifications so you never miss an update on important health topics that can help you take better care of your body.